Capacity building for clinical trials is a key component and constitutes one of the major objectives of the EDCTP program. EDCTP's approach in strengthening human research capacity for clinical trials initially was through standalone grants that were for masters and for PhD training. But later on, this was viewed as not a sustainable way of funding and strengthening capacity, because we wanted to link the utilization of the capacity that is developed to the capacity that is being developed. And in order to optimally do that, this was best done in the context of the projects themselves. There is funding towards master's level training and also funding towards PhD training. The researchers being trained may go for short periods of time to the northern institutions to acquire the rare skills that they want to improve on.
We also get the opportunity to share knowledge by went there, studying, and then when we come back, we are also able to train others.
The senior fellowship grants are aimed towards developing scientific leadership of the African researchers.
I'm part of the first generation of senior fellows that were funded by EDCTP. This helped us to build a team.
I think my senior fellowships sort of help not only capacity building, but also helping us achieve major milestones in our research.
Our EDCTP funded work was to build the capacity of our site and of our scientists.
So initially we had to have the staff actually assembled to make them confident in implementing the two studies. We are glad to the EDCTP that this kind of environment has been created.
In some sites we've built infrastructure, so we've built laboratories or put laboratory equipment into the sites, and in other sites we've built up the ability to deliver clinical trials by helping with data training people to do data monitoring.
In Kampala, in Uganda, one of the sites who are in development, there was a ward upgraded. Ugandan government thought that was a very good idea, so they half funded that ward as well.
EDCTP is also strengthening regulatory capacity, ethics capacity, and registration of clinical trials in the PACTRA framework.
Pan-African Clinical Trials Registry is an initiative that aims to collect information on all the trials that are conducted throughout the African region. In the last year, we've launched a geographic information systems mapping component on the website, which means that you can interact with the website, a live map on the website as trials are registered. So you can see locations and you can move down to city level to see exactly where trials are being registered.
3 levels at the moment are being addressed, and that is strengthening of both institutional and national ethics research committees, training, and the mapping.
So the MAC project is mainly funded by EDCTP. It's a 3-year project which aims at developing web-based, interactive and sustainable map of African research ethics committees and medicines regulatory authorities. So we are basically mapping the capacity of African countries to review health research.
We've set up new institutional review boards. We have set up community advisory boards to strengthen and sensitize the public, as well as knowing the rights of the people regarding participation in health research.
When we started in 2006, many African countries did not have research ethics committees. But now you can hear everybody talk about research ethics. Scientists are empowered. Everybody has had training. The impact has been tremendous.
cette initiative nous donne la possibilité de nous renforcer en termes de capacité, de nous renforcer en termes de qualité de recherche, nous a donné les éléments qui nous permettent maintenant d'entrer en compétition avec d'autres laboratoires bien établis pour attirer des financements et surtout renforcer les capacités de nos institutions.
Because we specifically target capacity development in all our activities to make sure that the programs that we undertake and also the uptake of the programs are going to be sustainable.